your Medicare enrollment windows. We measure our lives in moments, our birthdays, anniversaries, retirements, but when you turn 65, there's a date that matters just as much. And that's your Medicare enrollment window. The government gives you a 7-month window. 3 months before your 65th birthday, the month of your 65th birthday, and then 3 months after. And that's called your initial enrollment period. But there's a catch. If you wait until your birthday month or later, then your coverage could be delayed. And if you wait too long, then you might face a penalty. And that's a lifelong penalty. And while Medicare Part A might be premium free, Part B, well, that's a monthly bill. That's a different question. And penalties can add up. Now, if you're already collecting Social Security, you'll be enrolled automatically in Parts A and B. But if you're not, then the responsibility it's on you. It's all yours. So some people say, well, I have health insurance through work. You know what? That's great. And they'll say, I'll just wait. Again, that is okay. If you have creditable group coverage through your employer or through your spouse's employer. In that case, you may qualify for a special enrollment period, and that means you can delay signing up for Medicare Part B without any penalty, as long as you enroll within 8 months of leaving your group plan. But here's where it gets a little tricky. COBRA coverage does not count. Retiree coverage does not count. If you wait too long or misread the rules, you may end up uninsured or penalized or both. But then there's the general enrollment period. And that's from January 1st to March 31st each year, and it's for people who have missed their initial window. But your coverage won't start until the following month. And yes, you might still face penalties. And once you're enrolled, you'll have the chance to make changes each year during the annual enrollment period, and that is from October 15th to December 7th. That's when millions of people reevaluate their coverage, and they may be switching from original Medicare to a Medicare Advantage plan, or adding or dropping a Part D prescription drug plan. Or they're going to be reviewing their Medigap or Medicare supplement plans. So what's a smart person to do? Talk to someone who knows the difference between a Part A and a Part B and a Part C, and can explain why Part D might matter, even if you don't take any prescriptions. Talk to someone who understands what happens if my group coverage ends mid-year, or if the new employer's plan doesn't count as creditable coverage. Someone who's gonna walk with you before you walk into basically the penalty zone. Because in Medicare, guessing wrong will cost you. And now you know the rest of the story.